What's going on, everyone? This is Drew here at ASPS 2017, the meeting, joined by none other than Dr. Rappaport, my favorite person in the world.
Thanks,
welcome.
Drew. Appreciate it. Good to see you.
Good to see you.
Yeah.
How's the family? How's Houston? How's everything?
Everybody's fine. We survived the weather.
Okay.
Everybody was dry, fortunately, in my household. A lot of friends and certainly patients were devastated by the storm, but
right.
Houston's strong.
Cool. Awesome. Good stuff. So here we are. Lots of great sessions for you to attend at ASPS, but you're also here to do something else, right?
Yeah, actually, my participation, like so many of my colleagues, actually begins before the actual scientific session. There is organizational structure to ASPS, various committees, boards, and what have you, and I've been honored this year to be the chair of the trustees of the American Society of Plastic Surgery.
Awesome. So
with that, there's been some, obviously, meetings, preparation, some award presentations, and this afternoon I'm honored to be able to introduce my former mentor, my friend, as the guest speaker for the trustees talk.
Cool. Beautiful stuff. Talk to me a little bit about like the mentorship, because when I talk to all the doctors, I know that finding a mentor is really big in like where you decide to go with your profession. How does that work? Like early on in your career, how do you find a mentor?
Well, actually, mentoring actually starts in your residency.
Okay.
And it's really the responsibility of faculty, I believe, and the clinical faculty to, be supportive of the residents beyond just the educational activities.
Right, right.
I've always invited and suggested that our residents become involved in ASPS in terms of the committee structure, because I have found over my career that not only do I learn a great deal at these meetings, but that I have developed and made friendships that have been beyond my local community and are some of the best friendships that I have.
Great, good stuff. Are there any sessions that you're looking forward to attending that you know of so far? This is just day one. Did you get in today?
No, I came in actually, this is Saturday.
Oh, wow.
I got in here on Wednesday.
Oh, wow.
So we've been in meetings. I've attended a few sessions. Still have some committee obligations and things, but attending the general sessions, there have been a tremendous amount of educational courses. And what's really been neat this year is that the individual instructional courses have been included in the initial tuition for the meeting. So
okay.
People are really getting a good experience.
Cool. Awesome. Let's wrap up with this. So I know that your non-narcotic approach to post-surgery is really important. So just tell your patients a little bit about that for those that might not know what that is.
Oh, that's great, Drew. Thank you. Yeah. For the last 7 or so years, I've not used any narcotics whatsoever in my practice. And my patients are not the worse for that. They're actually better because they don't have the potential complications of the use of narcotics, including constipation, lethargy, or worse. So we begin a program of actually initiating medication the night before and the morning of surgery prior to their procedure, and then are able to continue through with the use of local anesthetics in the operative sites, along with the medication program afterwards, so that effectively patients do not need narcotics for virtually anything that we do in plastic surgery.
Awesome, cool. And how many people are doing that?
Well, it's catching on, hopefully.
Yeah.
We have a paper that hopefully will be accepted into print.
Okay.
We presented a national meeting last year, and it's interesting how many of my colleagues are actually asking me about this just by word of mouth. So hopefully we can have some impact and have people recognize that we can change the paradigm now to a little bit more patient-friendly.
Yeah. Cool. Good stuff. Okay, thanks for joining us. Once again, Dr. Rappaport, it's Houston Center for Plastic Surgery and the Houston Medical Center, one of the best plastic surgeons in Houston, I promise you that, and one of the best people I've ever met. So thanks again for joining us.
Appreciate this kind words.
You got it.